Okay, it looks like we can go ahead and get started. Thank you so much for joining us today to discuss the challenges facing the Superfund Toxic Waste Cleanup Program and a new campaign to make polluters pay for the cleanup of toxic waste sites. My name is Danielle Melgar. I'm the Zero Out Toxics Advocate with the U.S. Public Interest Research Group. And I'm very grateful that despite the limitations of the pandemic, we're still able to come together to share solutions and opportunities on issues like this. I am joined today by Jillian Gordner, U.S. PIRG's Make Polluters Pay campaign associate, leading U.S. PIRG's campaign to reinstate a polluter pays tax, as well as Gustavo Andrade, who is the organizing director of the Center for Health, Environment, and Justice, an organization that works with hundreds of community groups to achieve policy change and help residents fight against toxic threats in their communities. Kate Probst, who is an independent consultant on environmental regulation with over 2 decades of experience evaluating environmental policies and programs. Dr. Jacob Carter, who is a research scientist for the Center for Science and Democracy at the Union of Concerned Scientists, and Dr. Ed Lorenz, who is a professor at Alma College and the vice chair of the Pine River Superfund Citizen Task Force and at the US EPA Community Advisory Group. First, we will hear from each of these presenters as they address different pieces of the problem and discuss solutions. Then we will take questions at the end. For those of you that are on the webinar, you can put your questions in the chat and we will collect those. And if you have called in, you can text your question to 208-954-7956. And I'll repeat that number a few times throughout the presentation. Okay, first we have Jillian Gordner, who is US PIRG's Make Polluters Pay campaign associate, leading our campaign to reinstate a polluter pays tax. She is a graduate from the University of Michigan and author of US PIRG Education Fund's report, Superfund Underfunded, How Taxpayers Have Been Left with a Toxic Financial Burden.
Thank you, Danielle. I'm really excited to be here to talk to you all about the Superfund program. I'm going to start with a little bit of background about the program, which many of you may already be familiar with. But for those of you who don't know, Superfund was a program enacted by Congress in 1980 to give the EPA the authority and funds to identify polluters and hold them responsible for cleaning up toxic waste sites. And if they can't find the polluters or the responsible polluting party can't afford the cleanup, this program now had the authority and the funds to do that cleanup themselves. And a substantial part of this program is the National Priorities List. And this is a list of currently 1,327 sites, toxic waste sites, on this list that have been identified for the most serious long-term cleanup. And when this law was passed that created Superfund in 1980, it was passed with a tax on the petrochemical industry, what we sometimes refer to as a polluter pays tax. And in 1995, that tax expired. And today, the Superfund program is primarily funded by appropriations through the general fund or taxpayer revenue, rather than through money collected from polluting industries. And the danger of Superfund toxic waste sites is that there's toxic waste at these sites. So the chemicals are some of which you might already imagine or know of, like lead, mercury, asbestos, and other ones are those that I can't pronounce. And the danger of these chemicals is that they increase the risk for a variety of cancers, heart and respiratory problems. They can lead to stunted development, neurological issues. The problem right now also is in terms of the proximity. We see that 1 in 6 people live within 3 miles of a Superfund toxic waste site. And people can be exposed to contamination from these sites in a variety of ways. So it could be through air emissions. It could be from eating fish that was contaminated through water or sediment. It could also be from swimming in contaminated water or drinking contaminated water. And children are particularly vulnerable to these adverse health issues because, through the development process, and can even be exposed to contamination in utero if their parents or if their mother, was exposed to contamination. So now turning to the amount of cleanup that's going on or has been going on. Construction completion is a very important milestone to look at because it indicates that the physical work of construction has been completed. So it may take many years or even decades once construction of the plan has been completed for the site to be deleted from the national priorities list. For example, if construction was to install a groundwater treatment plant or system, it might take many years for all of the groundwater to actually be treated, and for cleanup levels, the level of contamination that needs to be achieved in order for the site to be taken off of the national priorities list is actually reached. And we can see from this graph here that from approximately 1991 to 2000, there were far more construction completions than in the following years. So for the past 20 years, there's really been a precipitous decline in the number of construction completions that we complete each year. And if we look at those last 20 years in terms of how much has been appropriated each year, we see that in constant dollars, it's decreased along on the same route or the same trend that construction completions have decreased over the past 20 years. And putting those two together, we can see even more clearly, even though, when we're talking about such large sums of money, when you go from 1999 to 2020, there's really a substantial amount of funding not going to the Superfund program. And that's reflected in the amount of construction completions that have occurred each year. I should note that this is using fiscal year. Another cleanup metric is remedial action started. Remedial action or remedial cleanup being the long-term cleanup. And we see a similar trend in terms of there being a lot of remedial actions started between 1990 and 2000, and then far fewer once you get into the 2000s and these past 20 years, which again, of course, correlates with the decreased funding since approximately 2000. And one of the scariest metrics you see when you visit a Superfund site's webpage is human exposure not under control. And what that means is that either people are being exposed or there is the potential for people to be exposed. So there are exposure pathways for the contamination to reach people that haven't been completely controlled, mitigated, or eliminated. And at 255 national priorities list sites, nearly 20% human exposure may not be under control. So that includes sites where the EPA does not have sufficient data to determine whether or not human exposure is under control. And the second metric that can be scary but confusing, maybe more so even at first, is the groundwater migration under control. So if we've kept the groundwater or the contaminated groundwater from moving into other areas, responding to groundwater contamination could include addressing the risk of consumption or contact with the water, the ability for it to spread into sediment, surface water, wetlands, and also the possibility of it going into buildings through vapor intrusion. So at nearly a third of national priorities list sites, groundwater migration may not be under control, again, including sites in which we have insufficient data. There was one major achievement though, in fiscal year 2020 was the number of partial deletions. And we see this again in 2019 as well. And a partial deletion is when the EPA deletes a part of the site. That could be a geographic part of the site. It could be a type of contamination. It could be a medium of contamination like soil or groundwater from the site. And we see compared to, every year up to 2019, there were 4, 5, 6, 7 a year. And then in 2019, we had 15. And in 2020, we had 13. And partial deletions are a good thing. We are showing community, investors, and people that we are cleaning up the sites. It is a step towards getting the site cleaned up, and that's definitely great. But in terms of a metric for how the program is doing today or has been doing in the past few years, it doesn't really tell us much about that in terms of actual cleanup action that's happening, because the majority of cleanup action that had to happen before a site is deleted or partially deleted occurred many years or even decades prior. If you recall when I said once you finish the construction on a groundwater treatment system, it may take many years for that groundwater treatment system to work. then ultimately after it's worked, after it's been built, then you could see a site or a part of a site up for partial deletion. So, looking at all of these numbers in the current decline in the number of cleanup actions we've seen, that's why we started the Make Polluters Pay campaign. And this campaign is to reinstate the taxes that used to fund the Superfund program to clean up toxic waste sites faster and relieve taxpayers of the burden of paying for the cleanup of toxic waste sites. And the long-term vision of this campaign is that no one should live with an increased risk of cancer, respiratory, heart disease, any illness because of their proximity to a toxic waste site, and the polluting industry is responsible, rather than the general public that's being affected by this pollution should pay to clean up these sites. And I know it's been a long time since we had this tax. And many of you who are working on this have been working on this issue for years. Many of you have been working on this issue for years, excuse me. But we believe we can reinstate it. And our strategy is to educate the public across the country on this decades-long issue, and teach them about the health risks that it poses, and raise visibility around the problem through reports, media coverage, webinars like this one, to mobilize the public to tell members of Congress that this is an issue that their constituents really care about, and that they need to act on. We will build access in the state, local, and federal level in order to generate the support and actually get our decision makers to support and even champion this issue. We also have a new administration, as you probably all know, and we recently have a new EPA administrator. So the possibility right now is looking good with all your support, and continuing to put on events such as this one. And also we have a petition that you can sign that will be dropped in the chat briefly, to tell your legislator to support a polluter pays tax. So thank you all.
Thank you, Jillian. There were a lot of great graphs in there, and I know there are people who were hopping on late, so I just want to let everyone know we will be sharing these slides with participants after the webinar today, and many of them can also be found in Jillian's report, which we will also circulate to attendees. Okay. So again, for the newcomers, we are holding questions until the end. So if you do have any questions, you can either drop them in the chat or text 208-954-7956. And next, we will hear from Gustavo Andrade, who is the organizing director at the Center for Health, Environment, and Justice, and our co-host for this webinar. So prior to joining CHEJ, Mr. Andrade worked as a labor organizer with Unite Here and the Change to Win Coalition, leading successful campaigns in Northern Virginia, Los Angeles, and Toronto. In 2009, he became the organizing director at CASA, the DC region's largest immigrant rights organization, and led countless efforts that improved people's lives. Gustavo?
Thank you. Thank you so much, Danielle, and thank you, Jillian, for that. I'm delighted to be here with you today. And I want to thank you to special thanks to all the local PIRG chapters throughout the country who are doing great work. So CHEJ was founded 40 years ago this year by Lois Gibbs, and her campaign at Love Canal was instrumental in getting the Superfund law passed. And as she says it, that polite people tend to get poisoned. The idea being that unless there is a wide effort throughout this country of people who are directly impacted by the pollution to speak out, sadly, we're going to be left with the current situation. So CHEJ's work consists primarily of identifying leaders in Superfund sites throughout the country and bringing them forward, amplifying their leadership, growing committees on the ground of people who have the information and the tools and the training available to them. And also we put folks in touch with one another because, as some of you on this panel may know, and certainly some of the attendees know, that there's nothing lonelier than to feel like you're up against giant polluters and there's not much you can do about it. The sad truth is that 53 million Americans are affected by this, but people aren't affected equally. That the industry has cynically chosen, they've undergone a deliberate effort to target the most vulnerable communities in the country when choosing a place where to dump their waste. Overwhelmingly, people are poor who live near Superfund sites. People are unable to defend themselves through traditional means and lack the capital necessary to solve the issue just by making phone calls. So organizing is not just the best strategy, but it's a necessary strategy for us to achieve our goals. So the health effects of particularly cumulative exposure over many years to the toxics found in Superfund sites is something that is under-researched, but certainly you ask anyone who lives near or in a Superfund site and the stories will make the hair on the back of your neck just raise up. We're talking about people suffering from cancer, kids being born with birth defects, and really atrocious daily fear and pain and anxiety that come from not knowing how your family is going to be affected. And the people paying the price, as I said before, the most vulnerable in the United States. That means that people of color, immigrants, Latinos, Asians, but most like Black folks in the South are suffering from this at hugely disproportionate levels. And that's something that's unacceptable. It's 2021. It's time we fix that. It's time we bring back the polluters pay tax, because that is the heart of the Superfund law. When this got passed in 1980, it was the mechanism by which we were going to fix these issues was through having a targeted tax on the worst polluters in America. This was never meant as a taxpayer-funded effort. This was never meant as a wide tax on all businesses, on large or small businesses. This was meant as a measure simply to hold those accountable who have profited over the last 40 years from dumping their toxic waste. In the cases where, I would say the vast majority of cases, we're talking about corporate polluters, but there are a few cases where the US military, who is one of the worst polluters in the history of the world, is directly responsible for people's pain. And in that case, they should be held accountable as well. So we have to remember we're dealing mostly with the private sector. As far as the EPA is concerned, the lack of funding in Superfund has essentially transformed EPA into a bizarro customer service representative service for the polluter industry, where they don't have the tools available, they don't have the resources, frankly, to clean up enough sites every year, but they do answer angry phone calls from folks, and anyone who's ever participated in a CAG can tell you that those meetings can get very contentious, and rightly so, because the community needs a place to vent their frustration. Now, we can organize until we're blue in the face and yell at EPA for them to clean up the mess. In truth is that their hands are tied until there's enough funding in the program to actually execute all the cleanup that is necessary. So in other words, EPA representatives have been put forth as the recipients of citizens' complaints where they're given none of the tools to address them. So all they can do is sit there, receive angry phone calls, get yelled at while the industry laughs their way to the bank. And that's wrong, that's unacceptable. And that's why we need to make polluters pay. You can follow CHEJ's work. We're delighted to be in this campaign along with PIRG and all the local leaders throughout the country who are fighting and have been fighting so hard to make sure that those polluters are held accountable. I just want to thank you all once again, and I yield my time.
Great, thank you so much, Gustavo. Now we will hear from Dr. Jacob Carter on the threat of climate change to Superfund toxic waste sites. Jacob is a research scientist for the Center for Science and Democracy at the Union of Concerned Scientists, investigating how science is used in the policymaking process and the impact of climate change on the containment of hazardous waste at Superfund sites. Prior to joining the Union of Concerned Scientists, Dr. Carter worked at the Environmental Protection Agency as an Oak Ridge Institute for Science and Education postdoctoral fellow. At the EPA, Dr. Carter integrated the effects of climate change on coastal flooding to determine the impact that coastal flooding would have on contaminated areas, including Superfund sites, in order to guide decisions on adaptation efforts that could better protect nearby communities from the spread of dangerous contaminants during future floods. Dr. Carter has a BS in biology from the University of Central Arkansas and an MS in biology from Kansas State University. He earned a PhD in ecology and evolutionary biology and a graduate level certificate in environmental studies from the University of Kansas.
Thanks, Danielle, and thank you, Jillian and PIRG for putting on this really important event. So I'm going to talk about a report that me and my colleague Casey Coleman, who's a GIS expert, published at the Union of Concerned Scientists, called A Toxic Relationship, which analyzes the potential impact of future extreme coastal flooding on Superfund sites. And I want to say from the onset here, I'm not talking about Superfund sites just on the national priority list, so official Superfund definition. Also looking at hazardous facilities that have been proposed to be on the Superfund site list or have been deleted that still could be or could have some hazardous contaminants that could be leached off even if there is a cap on that Superfund site due to flooding. So as already has been discussed today, there are hundreds of Superfund sites across the country. This is just a graphic showing Superfund sites a bit outdated now from the National Geographic Institute of various sites that have been proposed, active, or had construction completed. The EPA does maintain a list of all these sites in their various categories through their Superfund enterprise management system, which is really easy to access. They've made it great and accessible, and you can find all the information through EPA. Our analysis focuses on Superfund sites that are along the East and Gulf Coast. And the reason why we focus on Superfund sites here is because there is a high concentration of Superfund sites in the Northeast. But additionally, sea level rise is expected to accelerate faster along the East Coast, and the Gulf Coast is also especially problematic in terms of sea level rise because you have something called subsidence acting on the land there that is due to the process of glaciers retreating from the past. And so the land is actually sinking. And so we would expect sea level rise to accelerate faster in these areas and for flooding to be more extreme. Now, I'm going to talk about primarily flooding today, but there are other climate change impacts that can make Superfund site remediation and storage of contaminants particularly vulnerable. The Government Accountability Office published a report to this extent, looking at sea level rise just in general, flooding, inland flooding as well, not just coastal flooding, which I'll focus on today, wildfire, and a combination of these hazards. And found that there were many sites that could potentially be vulnerable to these climate change impacts in the future. Now, there have been Superfund sites in the past that have been affected by extreme coastal flooding, and which contaminants have leached from those sites. There is no known human contact as of yet, but EPA has done a great job, as well as the responsible parties who look over these sites, at keeping these contaminants really isolated. But as climate change effects become more extreme, it is a concern, an ongoing concern, that remediation activities could be impacted, as well as the storage of chemicals. As I mentioned, this has happened in the past. As is already brought up by Gustavo today, this is also a concern because of the individuals who live closest to these Superfund sites who would bear the brunt of the harm. These are mostly low-income communities, communities of color, environmental justice communities, who would experience most of the health risk if contaminants were to leach off in, say, floodwaters and spread into communities nearby. There was an executive order passed under the Obama administration, Executive Order 13690, that attempted to update federal flood risk management standards. It was rescinded right before Hurricane Harvey hit, and actually compromised the San Jacinto waste pits in Houston, Texas, by the Trump administration. But I think this was a great executive order. The Biden administration has put it back in place, so we'll have to wait and see what kind of guidance and further information comes up. I imagine they'll probably have to update the science, as climate change science is constantly changing. But this executive order attempted to update our federal flood risk management standards, which are were at the time and still are somewhat out of date. And included a number of different approaches to update these flood risk management standards. And one of those was a climate-informed science approach. So this was what I was helping EPA when I used to work as a postdoctoral fellow for the Office of Land and Emergency Management, sort of figure out what this might look like if a remediation project manager, for example, wanted to see what kind of flooding risks would exist for their site in the future, when that would occur, and that might help that remediation project manager determine when they would need resources to put in adaptation structures, which the EPA does have online, a great website from the Superfund office on different climate change adaptation measures that they put together. And I want to say too, the EPA has long recognized that climate change impacts will make their programs vulnerable. They have the former Office of Solid Waste and Emergency Response, which is now OLOM, has a climate change adaptation plan that recognizes these vulnerabilities and recognizes the adaptations that the program needs to take. So this has been an ongoing effort. Unfortunately, I think they were silenced during the past 4 years. But essentially, we worked together with various people at the EPA to put together a primer. Unfortunately, this primer was never published, even though it had gone through an extensive peer review process. So we ended up taking the work on at the Union of Concerned Scientists, and so I will be presenting the results from that work today. And essentially what we wanted to know is along the eastern Gulf Coast, where sea level rise is expected to be pretty extreme, where, when, and under what sea level rise scenarios would these hazardous facilities be most vulnerable to extreme flooding, and who lives next to these sites. So we know that the most underserved communities in the United States live next to Superfund sites in general, but would there be disproportionate impacts around these at-risk sites? So just a couple of methodological things. I'm only looking at coastal areas here. Our extreme coastal flooding is calculated as expected sea level rise. We worked with NOAA and a lot of folks in their Digital Coast office who were really great. But we used their sea level rise scenarios from 2017, which were used in the most recent National Climate Assessment, plus some base flood elevations that were calculated via tidal gauge data from Climate Central. We're conducting the analysis for four different scenarios, low to their high scenarios, so not the highest, but almost, which represents about 0.3 to 2 meters of sea level rise by 2100. We're conducting analysis for 4 time periods, 2040, 2060, 2080, and 2100. We use something called a bathtub model, so we rely on digital elevation model data that we receive from NOAA and USGS. As I mentioned previously, we're getting point location data of hazardous facilities from the Superfund Enterprise Management System. And once again, that does not, that includes more sites than just those that are listed on the national priority list. And we're creating a buffer around these sites because they are point locations. It doesn't really realistically represent how large those Superfund sites are or where the hazardous chemicals are contained or where remediation is occurring. And so to create a more realistic shape of that Superfund site, we use basically an average circular radius around that site, this buffer based on average size of Superfund sites across the country. So this kind of gives you an idea of what that model looks like in GIS. As time progresses, you'll see the blue areas expand. That represents the extreme coastal flooding. The white points on here are the point locations of the hazardous facilities, and as they become pink or yellow, those are the sites that we would find to be at risk of future extreme coastal flooding. So these are the results, for the East and Gulf Coast. On the y-axis here, the number of Superfund sites for each of our time periods on the x-axis, and for each sea level rise scenario, which are coded in this blue color. The darker blue represents the low sea level rise scenario, and as you get lighter, it gets higher. So you can see that the number of Superfund sites we would expect to be at risk according to this extreme coastal flooding model does change across time, and it does change across sea level rise scenario. The surprising thing for me was that even within the next 19 years now, was 20 at the time this report was published, so the most left bar here under the low scenario, we still find that there would be about 800 of these hazardous facilities on the East and Gulf Coast at risk of extreme coastal flooding. And that's just within the next 19 years. So that is, I found that pretty eye-popping. So we also looked at the people living around these sites that would be at risk from extreme coastal flooding. And so this is a graphic that's showing the number of people of color at risk around these sites. On the y-axis here, we have number of individuals in millions. And then on the x-axis, you have a buffer distance from the Superfund site of either 1, 3, or 5 miles. This is typically used in equity analyses, but essentially just a way to look at the number of folks that would be impacted within those buffer areas. The darker green color represents an expected number of people, and that number is based on census level data of coastal counties that are around these sites. And this is essentially the percentage of non-white people in those coastal counties. And then we looked at the observed percentage in these buffer areas around the at-risk sites. So we can see, would we find the same number of people around these sites that are at risk as we do in the coastal counties around these sites? And what you see from this graphic is that it doesn't matter what sea level rise scenario we're looking at. Essentially, we find many more people of color surrounding these at-risk sites than what we would expect. And so what that means is that if these sites were to flood in the future, it is once again people of color that would bear the brunt of the harm from those potential health risks. We also did a similar analysis for low-income households. We found the same thing, that low-income households would also are higher in the observed than expected. Once again, meaning that if these sites were to flood, the most underserved communities, low-income households would bear the brunt of the health risk from that flooding. We have a number of recommendations that we make in the report. One is to reinstate the executive order, which the Biden administration has already done, so that was really good to see. We also adopted some of the recommendations from the GAO report, including that the Office of Superfund Remediation and Technology Innovation, OSRT, provides some direction on how to integrate information on the potential impacts of climate change effects into flood risk assessments at Superfund sites. I was located in the headquarters office when I was a postdoctoral fellow. There was a real lack of some knowledge, I feel like, in terms of integrating climate change and really working, I think, cross programmatically with ORD at the time. So I think that will be really important to train people on global climate change models, climate change information in general. There was a training. I think EPA should go beyond that and provide more climate change training to really effectively integrate the information to flood risk assessments and other climate change impacts. And then the last recommendation I'll leave you all with is that we need more than point data for Superfund sites to more realistically model how these climate change impacts will affect the sites. I know EPA is working on that. They were working on that when I left, and it's a more difficult task than what you think it is, but that needs to continue as well. So thank you very much for your time, and thank you all for allowing me to be a panelist today.
Great. Thank you so much, Jacob. And I think it's the case that you have to hop off early. So I want to direct a few questions your way before we get to the Q&A portion later. First, we obviously see that this is a significant risk for many of the sites as shown in, on your map and through all of the different scenarios that you showed us. If a disaster were to occur at any of these sites, do we know how quickly or effectively contaminants could be contained? Is that information centralized anywhere? Is it, pretty different across all sites?
It's not something that I really have expertise in, so I can't really speak too much to that. EPA does have an emergency process for containing chemicals that leach off the site. So I think the spill at the Gold King mine is a good example for that. Although, the EPA did move very quickly. There were some communications issues there, but there is a full process that the EPA has to quickly move to contain those chemicals if they were to spill off. But there's only so much you can do when you have super extreme floodwaters coming through the area and picking up contaminants and potentially carrying them into communities. A lot of those emergency operations, if the floodwaters are too high, cannot operate. So there's only so much you can do, but I think there are processes that the agency does have in place to act quickly.
Great, thank you. And my second question, you gave 3 recommendations, which all sound like they would be very helpful for addressing this part of the problem. Is there anything that people on this call can do to help make sure these recommendations are addressed?
It's a good question. I think the Superfund program needs more resources. So I would like to see, I very much align with the Make Polluters pay campaign that you all are proposing. So I think that is great, and the legislative language that you all provided could be really useful. Something else that I think could be really useful and that people should really support is Senator Booker had introduced a legacy pollution bill that would appropriate a lot more funds to the Superfund program. I hope that gets reintroduced, and if it is reintroduced, I would really encourage people on the call to call their legislators and voice their support for that bill. As Jillian pointed out, a lot of the reason why cleanups are slowing is because there is not enough funds for the Superfund program. And that's going to affect the climate change work as well. Because, the work that, especially at orphan sites that EPA is overseeing, they will need funds to do the resilience work, to make these sites more resilient, to put in the adaptation infrastructure. And so those funds can go a long way, I think, in helping the Superfund program adapt to these future climate change impacts.
Great, thank you so much. That is all of the questions that we have for you. So thank you again for sharing all of that information.
Yeah, thank you.
Next, we have Kate Probst, who is an independent consultant on environmental regulation with over 2 decades of experience evaluating environmental policies and programs. She has testified in Congress multiple times and written several papers on the Superfund Toxic Waste Cleanup Program, including most recently Superfund at 40 Unfulfilled Expectations. For almost 20 years, Kate was a senior fellow at the Washington, D.C. think tank Resources for the Future. At RFF, Kate researched ways to improve the Superfund program and the U.S. Department of Energy's program to clean up sites in the nuclear weapons complex. She directed projects estimating cleanup costs, evaluating information systems, analyzing alternative liability and financing approaches, and examining the reliability of institutional controls. Kate?
Thanks. I'm really happy to be here today. I appreciate being asked to participate, and I'm even happier that there are now NGOs working on Superfund and calling attention to this program. It's been about 20 years before there have been any of the national NGOs that have really paid any attention to Superfund. So I think it's fantastic that PIRG is involved and Gustavo's group is being more visible. So let's go to the next slide. I was asked to focus on what would you do if EPA did have more money. And so I want to address 2 issues, the need for increased funding, and then what I'm calling reinvigorating the Superfund program, because while it is certainly true that a lack of funding has really damaged the program, it's also true that the program needs to be reformed in many ways. Next slide. So the first issue is that the Superfund cleanup budget needs to be improved and increased, my apologies. And people have touched on this before me. Jillian's slides show this, but not directly. There are actually almost 450 sites on the national priority list where cleanup has not been completed. They're not construction complete. Many of these sites have been on the NPL for literally decades, and some of them were listed in 1983. So it's really kind of atrocious that there's still that many sites where the remedy hasn't been constructed. Clearly, funds are needed at orphan sites. There's sites where there's no responsible party, there's nowhere for EPA to go get funding, and those sites need funding from EPA. Some of them are huge, like Tar Creek in Oklahoma, and there's just not enough money right now for EPA to clean up these sites. At the end of last year, there were 30 sites with cleanup projects ready to go that EPA couldn't fund, just as a little data point. The other thing is to accelerate cleanups at some of these sites. There are sites that cost literally $100, $200, $300 million for the remedy, and EPA's cleanup budget is about $600 million a year. So what they've done at some of these expensive sites that are fund lead is they dole out very small amounts of money a year, like $15, $20 million. Those sites are going to take a very long time to clean up. So there's both more money for more sites, but there's sites that are not being cleaned up and funded in the optimal manner. And if there was more money, EPA could do that. Finally, there are site studies and remedy designs that come before the cleanup. Those too get slowed down by a lack of funding. So increased funding would allow the whole EPA program to accelerate. Next slide. In recent years, there have been very few sites added to the national priorities list. And, having talked to many senior EPA people, one of the reasons they haven't added sites is funding constraints. They don't like putting a site on the NPL and then saying, geez, community, we've added this site, but we have no money, we can't move it forward. So there's a real disincentive to add new sites when they don't have the funds to even clean up the old sites. Last year, there were 8 sites added to the NPL. I suspect that there are more out there that need to be put on the national priorities list. Next. A number of people have referred to the fact that the potentially responsible parties, or PRPs as we like to call them, are supposed to pay for cleaning up at these sites. The majority of NPL cleanups are actually paid for by PRPs, not by EPA. So money to EPA is great, but what you really want is to also get more PRPs to clean up these sites. The responsible parties know that EPA does not have the money to take over cleanups. The original law and the legislative history makes clear that the goal was that EPA should have enough money that if you had a responsible party that was dragging his or her feet, EPA could say, okay, that's enough. We're going to do this cleanup ourselves and come back and recover costs. Everybody knows EPA doesn't have a lot of money right now. That is a very weak threat. So ideally, if there were more funds, they would go to enforcement, both to negotiate with PRPs to get them to pay to clean up, but also to make real the threat of EPA taking over site cleanups when the responsible parties are slow or recalcitrant. Next slide. Jillian mentioned my current favorite topic, which is the large number of sites where human exposure is not under control. This has been around for a while, this measure. There are currently about 130 sites where the EPA says human exposure is not under control, which means, as Jillian said, there is a potential risk. There are additional about 150 sites where EPA says they don't have enough data to tell somebody if the site presents a risk or not. I don't know why this hasn't happened, but basically EPA should review these sites immediately to determine what action could be taken to reduce or eliminate these risks, and then take that action. This hasn't happened. It didn't happen under the Obama administration. It didn't happen under the Trump administration. And it's the kind of action that a new administration can and should take, which is to say, we're going to review all these sites and see what we can do to reduce current threats. Next. The other thing that's pretty widely known is that PRP delays have delayed cleanup. Again, EPA has identified those sites where the PRPs have delayed cleanup for more than a year and bring enforcement action to get them to move. Finally, and this has also been mentioned, is to increase outreach to communities, especially the environmental justice communities. For example, it's likely that the EJ communities have a lot less political clout than some other communities. Reaching out to them to see if they need short-term removal actions or their sites that they wish were on the NPL is really crucial to making sure that the Superfund program is responsive to the needs of those who are affected by the risks. And then there's one, I think this is my last slide. There's one other thing that Gustavo mentioned that I think is really important and doesn't get enough attention, which is the fact that health impacts resulting from Superfund sites are under-researched. The Superfund law and the EPA program is designed to cut exposure, to say, okay, there's a site, we're going to clean it up, we're going to stop risks. The law and the program do absolutely nothing to address the health impacts that have occurred up until that time. So if you were in a community with a lot of lead exposure, if you were drinking contaminated water, and then EPA comes in and lists your site, there's nothing in the program that actually helps people who have had negative health impacts. And we know very little about what those health impacts are. So I really hope going forward that there's more attention to trying to understand what the impacts are on people's health who have lived near these sites for decades. Thanks very much.
Thank you, Kate. Before we hear from our final speaker, just another reminder of the number where you can send questions. That's 208-954-7956, or you can drop them in the chat. Next, we have Dr. Ed Lorenz, who is a professor at Alma College and the vice chair of the Pine River Superfund Citizen Task Force and the US EPA Community Advisory Group. He has written several published items, all growing from the regional environmental health issues, and was co-author of a study of DDT, one of our prime contaminants. The Pine River Statement, Human Health Consequences of DDT Use. After receiving his bachelor's degree in history and political science at Tosi College, Dr. Lorenz went on to get a master's in history at Georgetown and a PhD in history from the University of Chicago.
Well, hi, thank you so much for having me. And I really like sort of following those very insightful comments from our presenters so far. And I guess what my role in this is, I'm actually coming out of an individual site, actually a set of sites. And so maybe I'm taking sort of the case study approach everything that I have heard so far just reinforces what I think our site would demonstrate. So basically, real quickly to orient you, where I come from is a community that had a chemical plant that was sort of notorious for contaminating the local environment, making environmental mistakes, and this sort of thing. And we'll go over that a little. Here's a picture of it when it was in operation. And this was about 1970 when its emissions melted contaminants in the river. By the way, just to real quickly run through this, it had various names. It started out as something called Michigan Chemical. It became part of a larger chemical firm, national firm, Velsicol Chemical. That became part of something called Northwest Industries. And eventually they took the name of their one parent firm, Fruit of the Loom, the underwear company. So all those get mixed up in our site. Here's just a simple map. Geographically, we're in the middle of Michigan on a river, and this relates to Jacob's comments about the flood dangers, not from climate, but coastal climate change. But we've had floods along our river. It's a tributary of Lake Huron, the Great Lakes. Okay, and our site has spawned an awful lot of work. It just showed these 6 books written about the problems that came from our site. So we created a lot of good material for writers. And then to focus in on the actual community, we're in a community of less than 10,000 people. In the immediate citizens, 4,000 plus. And we have 3 Superfund sites, all linked to this firm. First of all, the grounds of where they produce the chemicals, 54 acres, right along this river, a place where they burned and otherwise disposed of some of their waste products, now called just the burn pit, and also the county landfill, where as county residents for a long time, they dumped all sorts of waste. I think related to our topic, the experiences at our site make 3 issues clear related to the Superfund budget. And that weird picture, by the way, is one of the things our company did is it contaminated the food chain of the upper Midwest. About 8 million people consume one of its products, and it contaminated farm animals, which had to be shot and disposed of. This is showing disposal. So, and I think one issue before moving on that it makes it complicated to work on our site, and I totally sympathize with the EPA staff that give immense amount of time to dealing with this, is what is, in Superfund terminology, we have a term operable unit, the place where they're actually working. Well, what is the operable unit for our company that contaminated dairy cattle over 100 miles from the site? Is that part of our operable unit? Well, it isn't under the way Superfund sites are identified, but what are the boundaries? Anyway, so focusing a little more on these 3 parts of the budget issue, I think. One is delays and ignored warnings cost money. And when a program like Superfund, lacks funds, we have to delay. In our case, we've had long-term delays, and from serving with others from other communities and various other Superfund communities and various activities, I know our story isn't at all unique, though it's often ignored. The idea that if they'd have known it was bad, they wouldn't have done it type thing is a repeated story of why we didn't take action in time when we actually knew things were bad. And I'm not going to go over all that's on this slide, but in the case of our site, the year this plant opened, a downriver community, Saginaw, Michigan, the city council unanimously passed a resolution and sent it to the state asking for something to be done about the contamination they were about ready to do to the river. Okay, so this is not like, oh, someone thought there was something wrong, but it was just sort of one of these green people who, they're on the fringe and they don't tell what they know to others and no one trusts them. This is a local government in 1935 unanimously griping that the contamination is bad. And I'm not going to review all of these, but all through the early history of this firm, there were warnings about the problems that we were creating, including, Kate just mentioned, we don't know much about the health, and that is certainly a problem. But in the 1940s, this company, by the way, made DDT, the pesticide. It also produced some fire retardant that we'll dwell on. But there were peer-reviewed health studies that this is a problem. One of our leaders in the early years, now deceased of old age, I think, not of contamination per se, but one of our leaders was one of the people who worked on the development of DDT for use during World War II. And, he pointed out in many ways, use of DDT in that emergency, whether it was in the South Pacific or places like Southern Italy, where malaria was rampant, probably saved lives. But it was known at the time that it had health problems associated with its use. And you should only use that sort of, product sparingly when it's a health emergency, not keep up the use. So we had warnings about that. If you go through the records of our state and of EPA later, after it was created, there was report after report specifically warning of the problems from this company. Here's like 1955. You can go through a whole list of these. It would be really boring if I showed all of them in the short run because there are so many of them. Okay, so that's one thing. We should do more with acting quickly and early. Sort of building on that, delayed responses just add to the cost and to human health exposures. So this company, we're at like an anniversary year right now. We're at the point where the cleanup of this place is now passing the number of years that this place operated, okay? And this happens at other sites. Cleanup takes so long. Naturally, it's complicated, figuring out where the contaminants are, what it takes to clean them up, okay? As a result of that, there are all sorts of human health risk that get to be greater because we're not acting. And we specifically have these. These aren't a worry that it might happen. Again, 8 million people, it's estimated, consumed contaminated farm products, milk, eggs, whatever. People lost markets as a result of then when they found out about the scare, farmers learned about this, and the public wouldn't buy products from Michigan. Workers at the plant, nearby residents, all this were exposed to hazards for years. Okay. Another thing is PRP cleanups, while they're good for the Superfund budget, from our limited experience, aren't sort of necessarily the best. In fact, ours was sort of among the worst. As it turns out, after 20 years after the firm was doing its supposedly excellent cleanup, EPA came back and found out that we were entitled to an emergency response because the contaminants in the environment near the plant site were so bad. So they went into this huge river sediment remediation project. And all this, and Fruit of the Loom, once that hit the fan, and there were other reasons all over the country to study Fruit of the Loom's problems, it's typical. Fruit of the Loom filed for bankruptcy, and they'd also already created a sort of a dummy corporation, a subsidiary of Fruit of the Loom that owned our site and a total of 7 sites around the country. It did nothing else except protect them from liability. It filed immediately for bankruptcy, so it had no money to pay for any cleanup at these 7 worst sites. Okay, and then the cleanup went on and on in the river. This was a huge job building, putting in cofferdams around parts of the river, drying it out, and literally just digging out highly contaminated sediment, and 750,000 tons. That's a good bit of contamination that had to be removed. And while this is going on, residents were coming forward and saying, yeah, you know, problems have continued here. We had birds dying on our lawns, you know, down through 2012, this sort of thing. And finally, we got attention because EPA was back, you know, back in town. And as one ornithologist at Michigan State University pointed out, when he told people out at conferences, for example, around the country, he was dealing with this, they were like, that's a 1960s problem. Birds don't die around houses. Well, turns out probably they did other places. They certainly did in ours. It led to a massive home lawn remediation, digging out the soil around houses, 90 homes in the community. And this meant people have been exposed to this contamination for probably at a minimum 40 years. And we also had to get a new city water system because it was found out our water was contaminated with a DDT byproduct after it had been told, everyone had been told there were no problems. So we're still going on. We're going to have a cleanup going on at this site for generations. Right now, they're in the midst of a thermal destruction of contaminants that are where the old plant site was. It was demolished on site and buried. They're boiling away the contaminants because, especially one, if you know anything about dibromochloropropane, it's so hazardous, so volatile. They don't want it to escape and probably sterilize a lot of the guys in town. So we're boiling it off. And so we have these big cleanups. And the last thing I want to, and reiterating Kate's point about human health, I just want to put, you know, an emphasis on that, because there are massive human health costs that are sort of pushed off to the side of Superfund, you know. So with us, with 8 million people who consume some of the fire retardant these guys scattered around the upper Midwest. And then there are the people exposed to DDT and this sort of thing. We are still in the midst of an ongoing human health follow-up of people. We have meetings. Until COVID hit, we had several meetings a year around the state where people like the one in that picture, people would show up. We work with Emory University's Rollins School of Public Health. We're doing the workforce. We are not funded under Superfund. Occasionally, Emory gets some funding out of NIEHS, the research end, health end of Superfund funding, but NIEHS doesn't get a lot of money. ATSDR, if you know what these acronyms I'm throwing around, ATSDR is also funded under Superfund, the Agency for Toxic Substances Disease Registry. ATSDR has done a couple really perceptive reports in our community, so that's praise for them, but they don't do anything else for us. They just have periodically every few years shown up and said, wow, there's a problem here, you know, but we don't get clinical responses. Those people sitting in that audience want someone to be providing what we call clinical responses. They have health problems related to the contamination from our Superfund site. If you go to one of these meetings, you hear people at times get up in tears and talk about, you know, women who've had constant problems of miscarriages, you know, deformed children, cancers, you know, and here's the budget of Superfund. I think it was 2019, a little graph showing ATSDR and NIEHS in addition to all the other problems of the Superfund budget being too small for, you know, doing prompt, thorough cleanups at sites. We have the problem that those two little pies out of that overall budget that go to NIEHS and ATSDR should be massively larger and be providing both health care, clinical responses to these problems. We do nothing for these people except find them to be sort of guinea pigs to show how bad the contamination are. And, you know, you go to our site, there's a list of some of the problems, the health problems that have been found for people with high exposures, you know, And so the big lesson, I think, in this is, we do need to do a lot more with human health. And just one final point is, and this has been touched on by each of the previous presenters, the Superfund budget isn't paying for all the cost of these contaminations. And especially, again, my emphasis on health. It isn't paying for these. What is paying for these are future generations. This is the ultimate inequity of what we're doing right now. So, we struggle along, we come up with some money, we pay for some follow-up and all this. And this is coming out of general revenue because the Superfund budget basically is fully inadequate to pay for these cleanups. I have some grandkids. I assume they'll have some kids. We are really doing them in. This company walked away. The repeated owners of this company, and not to pick on them too much, but they deserve it, made massive sums. These weren't people who struggled by, and because the companies went bankrupt, they had to move into, public housing and survive. These are people who had massive fortunes that they privatized from the company, and now we don't have the money to pay for the health consequences of the exposures they cause. So anyway, I'll stop with that. Thank you so much for having me and us. I really appreciate what you're doing. This is an important topic.
Thank you so much for that, Ed. I think it was important for all of us to hear, what it is like to be, dealing with this and trying to get this addressed in your community. And thank you again to all of our panelists for these wonderful presentations. I hope that everyone learned a lot from them. Now we will go into our question and answer section. And we've got a bunch of questions lined up, but for anyone who wants to send any last minute questions in, you can send them in using the Q&A function in Zoom, or you can send them to 208-954-7956. The first two questions here I want to address to Ed, since you just wrapped up your presentation. The first is just what has been the biggest challenge dealing with the EPA or anyone else involved in cleanup in regard to the Superfund site in your community?
Oh, okay. Yeah, I mean, in general, I think we have a good relationship with EPA. I mean, we have monthly public meetings of our community advisory group. We had one last night of all things. And, EPA sends staff who try to answer our questions and include us. I mean, obviously there are times, there are tensions, there are questions, that sort of thing. But I think the related directly to what you're doing today, I think the biggest problem is I sympathize with people making difficult decisions at EPA over how do you stretch a scarce budget, to do this. And then of course the second, which I already just said too, I guess, but just to emphasize that, I think, the people we deal with at EPA related to our site are all the people who are in various ways involved in trying to, as they always often say, moving dirt. They're trying to get rid of contaminants, contain contaminants, this sort of thing. They aren't human health people, and that's not their fault. They're coming out of that end. That's who we deal with, almost all the time when we're dealing with EPA. We had to find, and, we have these outside researchers doing work on the human health end of this. And because the EPA is so short of funding, and this has been going on, let's face it, since the creation of Superfund and long before that, our site is one of the ones, I probably shouldn't tell the whole story because it'd be far too long, but our site, related to the concern with flooding, our site was a plant site on a river, like that first picture showed. The cleanup allowed them, the initial cleanup allowed them to demolish the plant on site and contain it and supposedly put in a slurry wall surrounding it, isolating it from the river and keeping the water level inside fairly low, but not lower than the river level, by the way, above the river level, and supposedly the slurry wall was going to help. The day that was announced in 1982, that settlement, we were our 3 sites were among the first Superfund sites, by the way. When that was announced, a leading EPA official, some of you probably know Hugh Kaufman, young Hugh Kaufman then, criticized explicitly the design because I believe his phrase was, it's mighty risky doing this by a river. Okay, in 1986, we had a 500-year flood, which is sort of a joke because we've had multiple, I don't know what's going on, you know, we've had multiple floods, a climate issue, you know, this sort of thing. You know, and they're struggling with this. They have to live with what we got, a sort of inferior cleanup funded by a PRP. So I sympathize with EPA. You know, sometimes we wish they did something differently, but the budget is a core source of all our problems.
Yeah, thank you. Kate, actually a follow-up question on that. So you commented on the problem of money being spread thin and dragging out cleanup efforts at, you know, the most expensive sites and just across the board. Absent there being more funding, is there anything the EPA should be doing differently in terms of where they're allocating that funding to, you know, perhaps hit some of the most important benchmarks at these sites quickly and then, you know, adjusting funding after that? Or
you're asking, what do I recommend if there isn't an increase in funding?
yeah, if there isn't an increase in funding, do you see any places where the EPA should be, you know, reorienting their priorities at all?
Well, it's hard because I'm not the world's biggest expert on this, but their money comes over from Congress in 3 different tranches. They cannot move. My understanding is money, there's the remedial budget, which is about $500 to $700 million a year, which is not a lot of money. Okay, it's a lot of money to us, but it's not a lot of money. They can't, there are these 3 pieces of the budget. I think it's enforcement and Department of Justice, cleanup, and then other administration, and they're not allowed to move within that. I could make lots of criticisms of how they're structured and how they spend their money, but within the remedial budget, I don't know. I mean, some people have argued that EPA should do all the site studies and designs, even at PRP lead sites, to get them moving faster. They're the less expensive part, and then they would characterize the site as opposed to the responsible parties. So maybe you try to fund, I mean, in fact, at Gowanus, which is in somebody's slides where my daughter lives, EPA is doing that, even though responsible parties, as opposed to at Newtown Creek, which is nearby, which is taking forever. So there are some arguments to sort of goose the progress on the sites by EPA doing more in the early stages and leaving the expensive stages for enforcement. But they really are limited. They don't have 1.2 billion a year for cleanup. They have, as I say, 500, 600 million.
Yeah, thank you. This question is for Kate and Gustavo. You both mentioned 2 things that we really need to see happen. One is just researching and addressing health impacts that have been caused by, you know, exposure to chemicals at these sites over a long period of time. And then 2, incorporating EJ communities more. And I mean, just communities on the ground in general, but in particular EJ communities in addressing problems that are, you know, only recognized by people who are on the ground. Can you comment on, you know, the specific policies you would like to see happen in order to make sure that those are, you know, systematically incorporated into the EPA's approach?
Gustavo, you want to go first? I'll just talk.
Kate, please do.
Well, the health impacts is really a tough issue. Under the law, what EPA is authorized to do in ATSDR is extremely limited. So I would argue, and Ed's talked about this in Gustavo, I tried to ask ATSDR recently if they'd done a major report pulling together what do we know about negative health impacts, and I got no response. So the first thing is I think that we need to know more. It sounds like Ed knows tons. What are the health impacts? You would actually have to amend the law if you wanted either responsible parties or EPA to be able to provide healthcare. There's an interesting model, which is Butte, Montana, where Max Baucus got it declared a health emergency and they actually got insurance. So I think we need research, and then we're going to need legislation. I don't think they can do much more under the programs they have. In terms of environmental justice, I don't represent that community, obviously, but I've worked on this program for a long time. I have a huge concern about being able to get sites to EPA's attention. I mean, there are issues about who lives near a site. That's one set of issues. But the other issue is who gets their sites addressed. You know, these come from the state, these come from politicians. I would assume some EJ communities do not have the political clout to get their sites on the NPL. I know it's an issue. I'm probably not the best representative, is I guess what I would say.
Catherine, on behalf of the Latino community, you can represent us anytime. So I would say this, that I'm often reminded of this quote. It says that it's impossible to convince someone of something when their financial interest depends upon them remaining unconvinced. In other words, it is not a matter of debate whether it makes people sick to live next to radioactive waste or dioxin, or be exposed to DDT, or be exposed to any number of toxic chemicals, and many of which we don't fully understand. What the CEOs of the corporations who were responsible for the dumping do understand is that if the truth ever came out about the true health impacts, that this would lead to widespread change that would affect their bottom line. And so for those reasons, I believe the first and most necessary step to win for so-called EJ communities, for Black and brown people, for poor people, for anyone who is affected by Superfund is to reinstate the tax, because that is how we're going to fund a whole slew of beneficial improvements to the fund at a national level. Without that money being there, and without the recognition that those who did the dumping should pay for the cleanup and and be held responsible for all the health consequences for all of this, we can't move forward. So that's why making polluters pay is the number one step that we're working on. I would say something else that we haven't mentioned yet, but it's incredibly important that we don't reopen the entire Superfund law, and that we don't open to negotiation certain very, very important and valuable clauses in that law. The industry would love to agree to pay handsomely, would agree to polluters pay tax if it meant that they could skirt the levels of responsibility that are set forth in the law. And so I would say I would want to caution everyone against that. And lastly, I'll say that the people responsible, many of these companies haven't paid taxes at all. And if you look at the numbers, it's April 15th is right around the corner. And giant companies like Chevron, Occidental Petroleum, Duke Energy, Dominion Resources, Honeywell, American Electric Power, et cetera, et cetera, et cetera, these companies are allowed to literally get away with murder, and that's got to stop.
Mm-hmm. Jillian, can I say something unpopular?
And say, go for it.
I think it's clear that the Superfund program is underfunded and has been since at least 2000, if not before. From a practical standpoint, I would argue that if US PIRG and all these organizations put their energy behind increasing the amount of appropriations, that will happen faster and be more effective than trying to levy a new tax. And new taxes are not popular. And a climate tax is, I think, much more important. And there are lots of companies like at Ed's site where the bad guys are bankrupt. They're not paying. If you could get the polluters, that would be great, but you can't get the polluters because they're no longer around. Even I agree with Gustavo about companies that aren't paying taxes, but I guess as you guys move forward, to me, the question is, what's most important? To me, what's crucially important is getting EPA more money, getting stronger enforcement, getting at this human health issue. And I really think trying to get the taxes reimposed has a really low chance of success. So I just.
Yeah, I'll give you a chance to respond to Gustavo.
Catherine, I have to rescind your authorization to represent the Latino community after that comment.
That's fine.
So I would say that I totally understand the sentiment. I think there's a lot of people who are understanding of the sentiment that we need to improve people's lives. The reality is that taxpayer money at this point, if we just saw the $1.9 trillion relief bill that got spent, is in short supply. It's going to be nowhere near enough to make an impact. And so it is not just the principle of it that I see as being wrong. Like, there's no reason why Ed Lorenz's tax dollars need to be spent towards cleaning up that mess. There's no reason why Lois Gibbs's tax dollars and Penny Newman's tax dollars need to be spent to cover up for $1 trillion corporation's profits. And so I would say, in terms of what's possible or not, I would caution us against not being optimistic enough about what is possible in this moment, because we're living in a different political reality than we have been, frankly, in the last 20 or 40 years. That we do have leaders in Congress who understand that the recovery needs to be paid for, not by taxpayers. Taxpayers should be the recipients of the aid and not the people who we hit up to get us out of this huge mess that we're in. And the urgency is, frankly, it's, as Jacob was outlining earlier, we're talking about climate change, we're talking about sea levels rising and exposing even wider areas to that kind of pollution. In St. Louis, I'm sure Ed knows that there's an underground fire that is approaching, that is very close to a giant stockpile of radioactive material that's actually waste from the Manhattan Project from the US military. So the urgency's there. It's just up to us to be putting this on the laps of the leaders and holding the corporate CEOs accountable.
Well, if I could just add one thing too, because we mentioned like the companies, not having assets and this sort of thing. And I think one part, and it's somewhat where we've been, I'm sure, but two things. First of all, we really have taken advantage of the EPA's rules about a community advisory group. We've functioned for 22 years. We, raise money, this sort of thing. And I think one thing is if those groups could be strengthened, when we've gone to the rare meetings EPA has for community advisory groups, we find very few that are really active and really independent. We decided to get incorporated, and so we're just our own organization. I mean, they can object to something we do, but we're a nonprofit, And one thing related to companies hiding behind bankruptcy, we have filed multiple successful claims in bankruptcy court, and these are not like, we filed a $100 million claim against Fruit of the Loom, and essentially when it was litigated, 42 million was won for cleanup. And we went back, and there was a lawsuit to get the water system replaced in St. Louis, that was paid for by a lawsuit against insurance companies of Fruit of the Loom and Velsicol. So we got another award that has been our budget slush fund for now more than a decade. And I think communities have to be really aggressive, and and you get free help from state law schools, this sort of thing. This is how we've won. We haven't spent a penny on lawyers, and we've won multiple lawsuits. So I think we ought to encourage communities. I mean, this is sort of core, I think, PIRG stuff. We ought to encourage communities to organize. If you don't organize, you're really done in under this system because we don't have enough money. Anyway, I just put in a plug for taking advantage of some rules that are there. I mean, the Superfund, I think Gustavo said that, Superfund has a lot of good provisions. It's weak on funding, but it has some really good provisions that protect us, and we ought to take advantage of those.
Thank you, Ed. And thank you again to everyone. Unfortunately, we are out of time. There are still several great questions in the chat that we didn't get to. So we will definitely be sure to follow up about those afterwards. Just as long as people gave us all of your contact information, we'll be able to include you on that. So thank you all very much for joining us today. Jillian, can you put up that last slide with everyone's contact info? Yeah, so if people need to follow up, you can follow up with all of our panelists using the contact information that will show up in just a moment. And then we will send out a follow-up email to everyone who registered with our information, as well as a copy of the report. And we will respond to all of those questions from the chat. Thank you again so much, everyone, for joining us. And I hope you all have a great rest of your day and that you continue to stay healthy and safe.